how we detected gamma radiation. We had our gamma detectors. So this would be the detector. You've seen these around the neighborhood, and this is just the motor that we use to make sure that it goes at a steady speed. And this is the technician, and then he's recording all the data on his computer, and we also have it hooked up to a GPS unit. So each measurement is hooked up to an exact location, so we can always go back there and find that location. We covered more than 2.8 million square feet of the surface area, and we collected more than 1.5 million data points.
So if I could have just a quick show of hands, people raise their hand. Who in this room have seen the folks out there doing surveys in their neighborhood? Oh, good. Okay, quite a few people that came tonight. Great.
Yeah, and we also, so for areas that these can get through, maybe using the push carts is what we've used in backyards and other areas that are harder to get through. And we also have some handheld instruments. So what we did is we calibrated these detectors so that the technician was warned anytime there was a dosage that's more than 0.01 milligram per hour. So to put that into some perspective, if you were exposed to 0.01 milligram per hour for 24 hours a day, 7 days a week, for 365 days a year, you would be exposed to less radiation than the NRC limit. So that means you'd be exposed to less than your natural background radiation. You'd be exposed to significantly less. So that was our very, very, very conservative threshold that we used to say, okay, there is some radiation here. It could be it could be just from different soil, it could be from the rock, or it could be from something that the Navy left there, or we don't know what it is. But that's what that number means. So if the technician was warned that there was a radiation dosage was above this 0.01, or if they were going by and they said, oh, this is background, oh, now it's a little bit higher, it's still below 0.01, it's a little higher, oh, and then it goes to background, then in that case, we'd also take a second look. So a second look, it doesn't mean that we know there's something there, it means we don't know what it is. So we either went and took visual observations, so for example, we saw higher radiation dosage, and then we saw some gravel, that's what's causing that higher radiation dosage. Or we ended up, we would find the location and actually dig about 1 cubic feet of soil, take the soil out and scan the soil and see if there's anything there. So
Danielle, I have a question on previous slides. You talk about NRC standards, but the documents all talk about AE standards from 1974. And my question was going to be, why are you using such old standards, 1974 standards, when you have modern NRC standards? You're saying here you are, but the documents don't cite that. They all cite the AEC standards.
So it's a little important to differentiate between what we're looking at in terms of an environmental cleanup as opposed to what the 0.01 is what we used to monitor safety, basically. To see, okay, is there something there that maybe should be taken out or whatever. That's what we use. But the documents that we write, those are more for us to actually get a free release license from any of the properties. I don't know if you want to chime in, but you're kind of comparing two different things, because I don't know what you're actually talking about, but a lot of times you see 1.6 picocuries per gram.
1.7.
Or 1.7. So that's not in milliround, that's a different unit.
It turns out that there's like 3 or 4 of them. It makes it very hard to compare.
Yeah, so that's why we're trying to keep it focused on, in what I'm talking about is radiation dosage. So picocuries per gram doesn't give you a dosage, it just gives you the concentration of radium.
Yeah, so there's all kinds of different units of measure which are confusing to everybody, our team included, not just folks who don't do this every day, but even to us. So what we've tried to do in this presentation, and from here on forward to communicate more clearly, we're going to keep everything in what the health physicists are telling us really matters, which is dosage. And dosage is in things called millirem per hour or millirem per year. You hear all kinds of other terms that refer to concentration levels or disintegrations per minute or things like that. We're trying to keep everything in dose rates to be mean more to the folks in the neighborhood, because that, as I said, is really what counts.
But then how do you tell when you read a document and it says it's okay to have 4 to 6 degradations per minute, and that's safe, and yet you're talking about picocuries per, I'm even.
Yeah, so it is confusing. So,
But I mean, your documents are different than what you talk about here. So I come here, I understand,
Yes.
I get numbers, I go back, I read the documents, and the numbers that they're using are completely different.
Okay.
And sometimes, page by page, they change.
I understand that that's a challenge. When we talk to the public, when we want to explain things to the public, I think the best way to go is what is our decision to represent everything in terms of dose rates. When you're inside of a technical document, and for those of you who don't know Dale Smith, she's a RAB member, she does an excellent job of reviewing most of our documents and actually commenting on them. In those documents, it's required that we show what lab results were. And when we take soil off and put it to a lab, it doesn't come back in dose rates. That wouldn't make sense. It comes back in concentration, or how much radium is in that soil. So it does take, I hear you, I agree, it takes quite an amount of interpretation if you're going to go between presentations and documents in order to cover that. I'm not sure an easy way to deal with that, because, again, the documents cover things, intermediate steps before we reach conclusions like this that have to involve, for the regulators and so forth, have to involve different units of measure. But it all gets, in the end, when it comes to studying radiation, whether you're the state of California, or whether you're the Navy, or whether you're the United States EPA, it comes down to dose rates. And that's why we've tried to represent this here, so that folks can begin to understand really the thing that matters, which is a dose rate.